Sharp who said, Hi, my dear friend. Welcome to it, the first ever episode of Mind, Body, and Legal Matters. And so, as soon as you clicked on this video, you would have seen a beautiful introduction that sums up what the podcast is about. But just to give you a young summary of what you can expect, it's essentially an amalgamation of mental health issues, anything and everything body. And one aspect that threw me off when I first heard that it was going to be part of the chat is legal matters, right? Because truly, for me, it acts as the black sheep of the family. Because what do you mean legal matters? So in some of the episodes, we're going to be showing you how just stepping into a healthcare facility says a lot about the legal aspect or the legal side of life. But today, or at least two people that you should expect when you click on this podcast next time and forever, or at least for the most part, is myself, Bonso Morano, and I'll say my boss. Lumkile Nkosana, someone who both, or at least brings both expertise and a heart to the world of healthcare. He's a registered nurse, yes?
Yes.
He is a registered nurse with over 23 years of experience. When I heard this, I was quite shocked. But he's here, and he's essentially advocating for everything that has to do with healthcare and patients, and hence he started this podcast. He's the brains behind the podcast, essentially. So Beyond the Scrubs is also passionateness, okay? And today, on this episode, we're going to be deep diving into the world of kidneys. Yeah, two small but mighty organs that play a massive role in keeping our bodies balanced and healthy. And who better to guide us through it all than a true expert in the field? Joining us today is Dr. Mashabane, a nephrologist with, I like to say 16, correct me if I'm wrong, 16 years of experience.
Somewhere there.
In kidney health, in patient care, and I'll assume groundbreaking research, hence we have him here. He has helped, I'm sure, countless individuals manage kidney diseases, understand their kidney functions, and take proactive steps towards better health. So whether you've been diagnosed with kidney issues or have a loved one going through dialysis, or you're just curious about how to keep your kidneys in top shape, this conversation is absolutely for you. Dr. Mashabane, welcome to the podcast. We're so excited to have you here.
Thank you. Thank you for the invitation.
I want to break the ice by asking one of the questions that the students asked me today. Mm-hmm. I was at one of the shops by Campus Square, and then Lumkili will take over, okay? I met up with Lebo Mukwena. Shout out to you if you're watching this, Lebo. Lebo is a second-year biomedical science student, and they asked this. They said, Dr. Mashabane, with so many students relying on energy drinks and processed foods, what are the early signs that our kidneys might be under stress, and are these signs easy to ignore?
The problem with kidney disease is that it's a silent disease, and quite often you will never be aware that something is happening on the background until you've lost a significant amount of your function, 85% or so. Most people start showing symptoms at that time. If you know that you are really engaging in those activities, taking lots and lots of supplements, perhaps wise to just keep checking, screening once in a while. In some people, there might not be anything at all. Luckily, most of the kidney conditions manifest themselves through changes in the urine. A little bit of blood, protein, foamy urine, bubbly urine. And, those who pay attention, to their P will often come in and say, I've noticed some changes in my urine. But unfortunately, for the majority of people, it goes unnoticed until it is too late.
My goodness. I hope you got that one, Level. Without rambling any further, let me allow you, Lumkile, to take over. Take it away.
Hey, thank you, Ponzo. Welcome, Dr. Mashabane.
Thank you.
Yeah, signs of symptoms was one of the topics that we were going to look at. That was a good start.
Yeah.
Doc, sometimes patients, when they come to the hospital and then they are diagnosed of kidney failure or kidney disease, they always ask, are they going to get better? So there are those that get better, there are those that don't. So I would like the doctor to explain the difference between the two, the chronic and the acute.
Yeah, look, quite often if we say to you you've got acute kidney injury or acute kidney disease, chances are whatever you have, it's reversible. That's the simplest explanation to that. Anything chronic by nature, kidney disease is progressive, and even as nephrologists, we are not in a position to reverse that. The best we can do is to slow down the progression of the disease. So acute kidney injury or acute kidney failure, like it was, this is how we used to refer to it before. By definition, at least to the majority of the patients, is a reversible thing.
Are the causes different?
The causes are often different, yes, of course. Let me give you an example. I mean, if I get lots of diarrhea from food poisoning whatsoever, become dehydrated, I could end up with acute kidney injury, right? So treatment there, stop the diarrhea, proper rehydration, and hopefully my kidneys recover. And as opposed to somebody with long-standing diabetes complicated by kidney injury, that becomes chronic over a period of time. Unfortunately, for those folks, you will not be in a position to reverse that. Yeah.
Mm.
And I think the better way to say it is that with acute one, you sick, you feel sick, but with chronic, you don't.
You do feel sick with chronic as well. You know, kidneys can compensate and compensate very well. That's why you will not show symptoms, signs until it is too late. You know, that's the problem. Unlike other organs, you know, where you start feeling unwell the moment they are affected. You know, that's exactly what seems to be the problem with the kidneys. If they were showing symptoms right from the beginning, I'm sure we'll be able to slow down, reverse, cure most of these things. But because, especially with your chronic patients, they present to you right at the end. And by then, you just have to help them navigate through those challenges. Yeah.
Oh, thank you, Doc. And when we look at preventative measures, what is entailed in screening if we encourage patients to screen maybe regularly, like maybe 6 months or 12 months? What will the process be of finding out early?
Look, it depends. I mean, there are those we classify as high-risk individuals versus somebody who's otherwise well with no known condition. The truth is that no one goes around screening for heart condition, lung conditions, infections, whatever the case might be, right? And but let's start with the high-risk patient. If I'm suffering from diabetes, from high blood pressure, from any other condition known to affect, kidneys, we often advise that, depending on your condition, the seriousness of your condition, at least, every 6 months to a year. The frequency afterwards will then be decided upon by your treating physician. But for anybody else who is not at risk for anything, if you go for a regular checkup, yes, they may just look at your urine dipstick once in a while, but I wouldn't really going after the community at large and say, come, let's screen all of you for kidney disease. I don't think we do have resources to deal with that, yeah.
Hey, Ponzo, do you have any questions from your little survey that you've been running?
I mean, I do have some questions. I actually have plenty. I think I was with one of the guys that I work with last week when we met. Utabiso. I forgot what his surname was, or at least is, but I know that they're doing their 4th year in public health. And their question was more centered around communities, and it reads, in low-income communities around Johannesburg, including parts of Soweto and Tembisa, access to clean water can be inconsistent. How does this affect kidney health, and what low-cost preventative steps can people take? And this question is directed to you, Dr. Mashabane.
Yeah, look, quite a tricky one in a sense, because I cannot think of it as a direct insult to the kidney. But if you look at water, purified water, and unpurified water, anything that can lead to changes in the system, GIT effects, diarrhea, infection. We've been seeing lots and lots of urine infections and gastroenteritis as well, food poisoning. Anything that can potentially introduce infection on the system, leads to dehydration, can definitely affect the kidneys.
On that note, I am a gym fanatic. Since we're speaking about things that we consume and how they can lead to some kidney diseases.
Right.
I kind of take some pre-workout, maybe not. And
Do they help?
You know what I mean? And maybe I consume more protein shakes more than food. How can that affect my kidney? Because I remember even telling Lumkile that I have this pain around my kidney area, and sometimes it becomes a bit hot.
Right.
And I don't know what causes that.
Look, let's just be honest and say that, there are whole lots of other things happening. Yes, the 2 kidneys are located at the back, and but they are all the spinal cord there, a lot of muscles there, and by far most kidney conditions are not painful. And as a matter of fact, the majority of the patients that I see with some back aches, I end up referring them to physios or to the spine guys, and they get sorted out, And if it is an infection, yes, you can have one-sided back pain, but that will often be accompanied by symptoms of infections, fever. When you pass urine, it burns, uncomfortable. Then you know that something is going on there. Especially with the guys who are so much into sport as well.
Yeah.
So many things can go wrong. Quite often what we do, people like to lift or run or cycle with very little stretching, to be honest. And then they often experience back muscle spasm, etc., etc. Now, talking about the supplements, it's quite a tricky one. And we have seen few people, who've been consuming lots and lots of protein supplements, especially the ones that contain the substance called creatine.
Yes.
And I often say to people, stay away from creatine the best way possible. And the truth is that I'm not sure, the percentage of those who are on to creatine will end up with kidney disease. But we've certainly seen a few of those guys actually coming in with some forms of even irreversible kidney disease. I guess, long-term exposure. But remember that most of these conditions, you are sometimes genetically predisposed. Then in the right setting, maybe of being exposed to creatine, you couple that with dehydration. And some people, those who wake up a lot, they end up actually taking some form of analgesics as well. The combination of all these things taken together might actually end up predisposing them to kidney disease. Yeah.
I think I've just been diagnosed. I don't stretch before lifting because I love lifting. Right. I don't consume as much water as I should be. So thank you so much, doctor.
And said, because most of us, we don't consume enough water, if I can ask. We don't hydrate well. But there's a lot of the promotion of creatine products on TikTok especially.
Everywhere.
So I think maybe we should look at that.
Look, I'm not sure really. I've seen actually not so long ago, somebody was talking about it as well. I was driving to the gym as well. Oh no, I'll take loads of creatine. And I just said to myself, definitely this person is not a nephrologist. I'm yet to come across, but, it's, We need to, if I was on lots of creatine, and I'll be paying attention to my kidney function as well. But there's lots of muscle breakdown as well. Let's just be frank about it.
Yeah, that's
during strenuous exercises. And the duration of the exercise, the frequency of the exercise. And then you add a couple of things, creatine, analgesics, dehydration as well. That's a good recipe, for a disaster.
Yeah. I think we need to have part 2 of this. So I want us to get into the fitness side of it all. Because truly, UJ is just one of those institutions. That's my school, where they prioritize sports and exercise. So because we are somewhat made to believe that it's important to balance your life and exercise, you go too much into it, and we end up consuming what we're not supposed to consume to give us some energy and whatnot.
Okay, Doc. Talking about, we have a lot of stuff to talk about, but we don't have time. I think in one of our episodes, we should actually ask a cardiologist to talk about it, because if you're gymming, you realize that there have been incidents of people collapsing in the gym.
For sure.
A lot.
For sure.
And Doc, I know you run also. So
you're the perfect person for this.
Look, it's I try harder, but I don't take creatine, all right? Yes, I do run. I accept that. I've got comrades in 3 weeks, so.
Oh, come on.
That was serious, buddy.
We need a lot of students to pay attention.
And on treatment, on kidney failure, what options of treatment do you have?
Depends on the cause. Let's just be honest. It depends on the cause, right? And let's look at the acute causes. Acute kidney failure or acute kidney injury. Let's look at the commonest causes. It could be anything. GIT, I've got diarrhea, stop the diarrhea, rehydrate, hopefully I recover. And I pick up an infection, let's say I visit Maputo, Mozambique, or Mpumalanga, or anywhere I pick up malaria. That can also be complicated by kidney injury. And the treatment there will certainly be fine. Let's address the cause. If it's pneumonia, treat the pneumonia. If it's malaria, treat the malaria as well. Some patients might actually get away without requiring what you refer to as kidney support. This is dialysis. Some patients will get away without dialysis. Some patients do end up requiring dialysis. And I often say to patients, listen, dialysis is an artificial kidney. It does not really cure your kidney failure, but it will support your kidneys while they are actually recovering. Once the acute insult is gone, they do start kicking back in as well. Unfortunately, with acute kidney injury, some people will recover 100%. Some people, unfortunately, they do not recover in full. They end up with a residual impairment there. And then there's a small proportion of people who don't actually recover and they remain on dialysis, for life. That's the unfortunate thing. Now, the chronic kidney disease, again, there's just so many causes, genetic, acquired, infections, malignancies, systemic conditions, substances, the list is endless. But nevertheless, there are warning signs sometimes, to those, as I said earlier on, that if I had diabetes, I would want my treating doctor, at least minimum once a year to look at my urine, look at my kidneys, just to make sure that everything is still in check. If I had high blood pressure, I'll probably be doing the same thing as well, and lots of other conditions that are known to be affecting the kidneys.
Oh, yeah. And I got a question that's bothering most of the young ladies in the dialysis unit, which is pregnancy.
Oh my gosh.
Yeah. People are worried. People want to get pregnant. People want to get married,
Exactly.
Yeah.
Just the whole reproductive system and...
it's it's difficult. We've seen lots and lots of... Let's just start by saying that once you've got chronic end-stage kidney disease, we often say to patients, it's difficult really to make it simple in layman's terms. But, every time I've got a patient in front of me, I'll say to the patient, listen, you've got an estimated functions say, of 60% or 20% or 10%, whatever the case might be. But quite often, when we talk about end-stage kidney disease, those are patients with kidney function way below what you call a GFR, and in layman's term, I'll say to people less than 15% or so of kidney function. But the actual unit there is your glomerular filtration rate. So there are a whole lots of things that will change, and part of the system that will be affected is your reproductive system. Especially in women, their menses become irregular, and sometimes they don't see menses at all. And the danger with that, some of them do stop, their contraceptives, and then they actually end up becoming pregnant as well. Males do get affected as well. But if you do have kidney disease, regardless of the stage, we often say to you, try avoid pregnancy, especially once you get around the GFRs of 30, 40, any degree of kidney disease at any level of chronic kidney disease. If you do fall pregnant, there is a high likelihood that your kidney disease will actually progress.
I'm a woman, and when it comes to the chat of kidneys, I can't help but feel like it affects women more than men, especially because when I studied biology/life science back in my days, I learned that the dilation of blood vessels turns to affect the kidneys, right? So the filtration that happens there, and also my hormones also cause some dilation to my ureters, which somewhat and some way affects the kidneys. And so with just that information, I feel like women are more prone to kidney diseases and just problems, which then affects the reproductive system.
I don't know if we could say more prone, but we can say as far as reproductive system is concerned, it has more effect on women, because men just secrete and then they're done.
That's it.
Then the job is carried on by a woman.
Yeah.
And that's why I wanted to ask doctor to go further on terms of pregnancy. The doctor has already said you can fall pregnant, but what we really need to know, because people just get excited when they say you can fall pregnant, then they will go fall pregnant.
Yeah.
But the question is, with that imbalance, electrolyte imbalance in your body and hormonal imbalance in your body, can you carry a baby full term, and won't it be affected?
That's a good one.
Affect the growth of the fetus?
Well, I'll summarize it the best way I can, just covering this different categories of kidney disease. Males do get affected by chronic kidney disease as well. Their reproductive system takes a knock as well, not just in women alone. Now, if for young women in their reproductive age, if you have been diagnosed with kidney disease, please do consult before you conceive. It is just in your best interest. And unfortunately, because of pressure from the society, marriages, friends, etc., people tend to ignore our advices, and they end up with horrible results. You do run the risk of losing your life. Now, for those patients with severe forms of chronic kidney disease, especially the ones who are on dialysis or yet to be started on dialysis, we do know that the chances of conceiving are much higher at the beginning of your dialysis. And we advocate a use of contraceptives, that's number one. And the majority of those women who conceive will terminate spontaneously within their first trimester. So with kidney disease, there is a risk to the baby, there is a risk to the mother. From the mother's point of view, you can actually suffer severe complications, very high blood pressure, loss of proteins, your preeclampsia, your eclampsia, your pulmonary edema, your lungs being affected, your heart being affected.
Oh.
The end results could be death, yes. And once you start experiencing those side effects, sometimes you've got no choice but to actually advise medical termination.
Oh my gosh.
Most people will still say, no, we'll take our chances, right? Now, for the baby as well, there are a whole lot of other horrible experiences that the fetus is actually being subjected to. Let me perhaps start off by saying that most of these kids are born prematurely with a very low birth weight as well. And they do run the risk as well of ending up with other congenital malformations. If you are on dialysis and you happen to conceive, if you are, from being dialyzed 3 times a week, and most centers nowadays will actually convert you to 5 to 6 times a week of dialysis. So now you end up spending more time in the dialysis unit, going up and down. And with changes in your blood pressure system, with changes in your fluid status, your clotting abilities and everything else, the risk, is actually not worth it. I have personally looked after young women on dialysis who actually fell pregnant, and I must say that probably I can only recall 3 who successfully carried pregnancy to term. The majority of them either terminated spontaneously within the first trimester without real serious complications, and few of them ended up, pushing for medical termination. The best way is to wait until you are transplanted. It's safer, to fall pregnant once you are transplanted.
Sure, that's hard.
Yeah.
Bit challenging. I mean, look, it's a test of love, because if your partner loves you so much, then it's okay, let him donate one of his kidneys. Then you can give him the baby in return, right?
Oh, thank you for that. That's a good point.
Give a kidney for the child.
Exactly. And for your wife.
Yes.
And for your significant other.
Yeah. No, that's great. Doc, maybe if we can go into explaining dialysis, because we've been talking about dialysis a lot. And people want to know what it is.
Again, it's an artificial kidney. Let's just put it like that, and it does not replace the original kidneys, but it takes up the major functions of our native kidneys. But our kidneys, they do release hormones. They release enzymes. This is on top of regulating the acid-base status in our bodies, regulating the water balance as well. But what we can only achieve with dialysis, and unfortunately, dialysis machines that we use cannot release enzymes, hormones, and etc. But at least they are good in terms of getting rid of the toxins. Unfortunately, because, you cannot be on dialysis 24 hours a day, 7 days a week. That actually equates to about 168 hours a week or so. If you are on hemodialysis, on the machine, we dialyze you for 12 hours in a week. So there's no way that 12 hours of being on dialysis machine, the results will be as good as somebody who's got a normal functioning kidney. But with the machine itself, with the dialysis itself, we can help regulate your acid-base balance. We can help regulate your fluid control as well. We can help to clear as much toxins as possible as well. But unfortunately, it's something that you must do for life if you've got end-stage kidney disease, or until such time when you can be transplanted.
Got you. Is it time for the Q&A now? Is it? I'm so excited.
Yeah. And then we have, I think, 2 types of dialysis.
Oh, okay. Oh, we're still going deep into dialysis.
Yeah, look, I mean, there are 2 types. Yes, one is hemodialysis, and it's a machine dialysis. You come to the center 3 times a week, 4 hours at a time, 12 hours in 1 week. And then the other one, it's what we call peritoneal dialysis. We train you to dialyze yourself at home. The difference is that the in-center dialysis is 3 times a week, 4 hours at a time. While the peritoneal dialysis is something we train you to do it at home every day. It's continuous. And this has lots of benefits. I mean, there are pros and cons for each mode of dialysis. My best one is still peritoneal dialysis.
Oh, you have a best one. Okay.
Okay.
Oh, my preferred one.
I see. You know what I love about the questions that I'm about to ask you, Dr.
Right,
Mashabane,
right.
is that they come from people that are genuinely concerned.
Good.
And I love the fact that we are getting it from different and diversified minds.
That's fine.
Right? So I have one here from a nursing student, and they're doing their first year, go by the name of Zanele Mtetwa. And the question reads, is there a lot of confusion? Oh, no, it's a statement. There's a lot of confusion about whether drinking a lot of water actually cleanses the kidneys. What's the truth behind this common advice?
Yeah, look, unfortunately, we all grew up, or at least in my days, yeah. You know, the message was drink 8 glasses of water per day.
Yes.
Not sure what's the science behind it. The only thing is that I never heard anybody saying, except when you've got kidney failure or heart failure,
Sure.
you know. So, but I often say to my patients, yes, drink water, especially more so when you are thirsty, yes. But the only time when I advocate high intake of water is in those patients with kidney stones, you know, because lots of stones do form because of sluggish flow, buildup of acids, and all the other ingredients, you know, in the system. You know, those patients unfortunately end up, you know, sometimes taking 3.5 or 4 liters a day of water.
Sure.
The problem is that when you've got kidney failure, you know, most of our patients with kidney failure, especially the ones that are on dialysis, they are not even passing a drop of urine a day. So now you can imagine that, you know, if these guys take 1 liter of water a day, they actually drown and
Yeah.
they do run the risk of dying. And it is really a problem because, you know, you think that, you know, people advise themselves on the street, you know, oh no, my doctor said I've got kidney disease. Oh no, don't worry, just take 5 liters, 4 liters a day. You end up drowning and killing yourself. You know, so the circumstances are different, and I think that I still like the 8 glasses, you know, 6 glasses of water per day, assuming that you are okay, you are not on any form of medical therapy. You know, some people work in air-conditioned places, you know, they are not exposed to the sun, they don't do lots of exercises. But if it's summer, I'm working out there, I'm exercising, I'm jogging, I'm losing lots and lots of fluids. Yes, I need to replace that. And I must actually be mindful. Otherwise, I'm going to end up with dehydration and end up with kidney injury. But assuming that you're doing none of those, you know, just keep it in balance. 6, 8 glasses should be fine.
So for my gym phonetics, it's important that you hydrate.
Yeah, I mean, you definitely need to pre and post hydrate. You know, that's
Exactly.
important as well. But then sometimes it's also important because, I mean, we don't sweat the same way. Let's just be honest, you know. Some people sweat like they've just come out of a swimming pool.
Literally.
You know, while some people, it's just few drops in their forehead. So we just need to be mindful of that as well. Overhydration can also be dangerous, to be honest with you, and because there are electrolytes that are actually at play. You know, I've seen people becoming confused, going into coma because you just drop so much of your sodium if you overhydrate. So there is some formula there, and especially if you're just using pure water without any electrolytes whatsoever.
On that note of physical activity, let me take you back a bit because it's a question that I have. Kagiso Ndlovu, a 3rd-year sports science student, asks, for athletes and gym goers who take supplements, and you have definitely answered this, but I'd like you to kind of go into it again, especially for Kagiso. So for these folks that take supplements like protein shakes or creatine, is there a safe limit before it starts harming the kidneys?
I think we don't know, to be honest. And there must be a tipping point for everybody. You know, and not every person with diabetes end up blind. It's a fact.
That's a good one.
You know, not every smoker ends up with a cancer.
Oh, that's a good one.
You know, so we often have, you know, sometimes it's okay to say, don't do this, don't do that. Not everybody who's exposed, you know, to creatine supplements will actually end up with kidney disease. You know, but unfortunately for those folks who are actually at risk, you know, of kidney disease for other reasons, Probably the only thing that they might have been missing was just, that element of being dehydrated, muscle breakdown from over-exercising, coupled to, so it's a multiple thing.
Yeah.
But if I was taking lots of supplements, if I was really crazy about endurance exercise, intermittently, especially peak season, I'll be actually double checking my kidneys just to make sure that the system is in check. The same way that you'll actually go and say, there's a warm-up, there's an intense phase and there's a recovery. Our bodies do take knocks sometimes. As a matter of fact, endurance exercise is not healthy for our body. Let's just be clear about that, right?
What?
And look, it's not. We subject ourselves to all this trauma. We often tell ourselves that we're going to adapt. We do adapt, but physiologically, it's not healthy. Let's just be clear about
I'm so shocked. Oh yeah, this is one controversial point.
Okay, yeah.
Oh, there's no controversy there. Is there, go back to the literature and see, you can't tell me that, you run 90 kilometers of comrades and then what are you trying to prove, And then you think that physiologically it's okay. We run because we can, but the truth is that, either the joint disease, the heart, the lungs, whatever, the kidneys, I'm sure that if you had to screen everybody, every finisher, of those of those competitions, and you'll actually gonna end up with lots and lots of abnormal results. But that's just a topic for another day. But we do it. That's why you need to start slow, build up slowly. But even so. Depending on what you do, how much you're doing it. There's a thin line between, the healthy limits and the obsession limit of some sort. Yeah. We do push ourselves sometimes beyond those red zones, if I may put it like that. Yeah.
I like that. Let's share our thoughts in the comment section. I'd really like to know what your thoughts are. So leave a comment and kind of tell me if you're also part of the gang that,
I need an antidote.
All of that.
Yeah.
Okay, I have, last but certainly not least, Naledi Ramaphosa. Naledi, hi. Is an honors student majoring in environmental health. I think this is their research focus, environmental health. And they asked that we asked Dr. Mashabane, with rising temperatures and water scarcity due to climate change, are we seeing new patterns in kidney-related illnesses, and what role can public education play in prevention?
It's a good question, and the direct answer is we haven't noticed much changes, from that point of view. And either because we are not specifically screening for that, and, we are still behind. I think most, there was a time when we went around some malls, like screening for kidney disease by means of looking at the urine dipstick and simple creatinine test. And we picked up lots and lots of undiagnosed problems. Some of them, the majority of them were very, very mild. But I'm sure that with time, because climate change is going to force us to change our behavior and the way we actually, do things on a day-to-day basis. It's a matter of time, I guess, before the world of kidneys is actually affected as well.
Love that. I guess everything is interconnected, like how
it is.
Do you know what I mean? Yeah. From the environment to our food, to water, to our bodies, and how we essentially think and perceive life. Because now, this conversation got me thinking, should I even run tomorrow morning or not?
Please.
You should. You should. It's not an excuse to be lazy.
It's going to be my excuse from now on. I'm going to be like Dr. Mashabane said.
I know. Look, I run 5 times a week, so it's
what?
It's a peak time, 100 or so kilometers a week. So you do.
You know what I'm taking from this is that if you're going to supplement, rather get to a doctor and check the levels of what you are supplementing. Because there's a level to everything. There's a limit to everything. If you're supplementing your proteins, check your proteins. If you're supplementing something, even that creatine, even though creatine, actually the levels goes up and down quite quick, isn't it, Doc?
Yeah, I mean, look, the funny part here is that we like to supplement without knowing if we are deficient or not.
Yes.
I'm sure that's the point that you're actually making.
All right.
Okay, I think we are reaching the end of the podcast.
I think we are at the end of the podcast. I have a feeling.
Yeah, we did. But just one last question. Doc, what would you like at the end? What do you like to emphasize to your patients? I'm sure you are educating your patients every day, but who are listening to this, who are not listening to you in the ward, but they are listening to this? What will be your message?
Look, encourage lifestyle exercises and a low salt diet, and just for us to be mindful of what you're eating.
That's it.
Yeah, I mean, you can only do so much. There's
Yeah.
lots of processed food out there, and there's lots of, with high salt content, there's lots of lift and escalators out there. And we are fortunately in a country where we don't walk as much as we should.
Exactly.
People hate exercising, and people are quick to enjoy a full breakfast without even creating a space for it. So do the best you can and look after yourself.
Yo, that's a good one. That's absolutely amazing. It's been a good one.
Yeah,
I think
it has been a good
we've
one,
definitely
yeah.
learned a lot. Let me know if you would like to have Dr. Mashabane again. I think if you say it, he will see it and he will come back again, depending on the burning questions that you have for him. If they surpass 10, then he has to come back. We have no choice but to bring him back. He's a nephrologist with over 16 years of experience in kidney health and patient care and everything in between. We wrap it up just like that. And like I said, everything is interconnected. So is your mind, your body, and legal matters. Until we'll see you on the next episode. Our time is up and we absolutely thank you for yours.
Thank you for